This segment demonstrates elements of the pain module, including beginning with the large group prescribing exercise of Fred, using the exercise results to establish a baseline of existing practices and gaps, using the module, especially the small groups, to challenge learners to critically consider current pain practices, and using the unidisciplinary small groups, tools, and processes for maximum effect.
Right, so this is what we got. So someone suggested a regular dose of morphine. Could someone help just write this on the board? Maybe just write there morphine and the dose. So morphine, 5 milligrams Q4 hours, and this is excellent, a breakthrough, Q1 hour PRN. Okay, and we'll talk about this concept of breakthroughs. Okay, and then after the titration, so I presume when things have settled down, long-acting morphine. Drug to decrease inflammation, an anti-inflammatory. OT assessment for a walker. Okay. Right, then someone wrote morphine 15 milligrams, slow release twice a day, and morphine 2.5 to 5 milligrams. So this is a short-acting formulation. That's a long-acting one. So this person decided to go with the long-acting drug. Gabapentin at 150 milligrams 3 times a day. So the question is, why gabapentin? Effexor, which is an antidepressant, okay, and Ativan on a PRN basis. And this is important, Senecot and lactulose. Aha, so those of you who put in a laxative get an iPod. Okay, so here's another controlled release formulation of morphine twice a day. PRNs. Decadron. This person decided to add Decadron. Add a dose of 4 milligrams twice a day. Serax, anxiolytic. Monitor blood sugars, I presume because of the Decadron. Whenever you're using steroids, make sure that you just keep an eye on the sugars. That's a good reminder because we sometimes forget about that, and they can sometimes go very high, particularly in patients who are diabetic, as this patient is. So, well done. Okay, naproxen, 500 milligrams, and Tylenol number 3. So this person decided to go with a combination of a codeine falls into which step? We'll discuss a step ladder, but codeine falls into step 2. Okay, so this person decided to go with a step 2 analgesic opioid, codeine, plus an anti-inflammatory. Okay, this person has gone with Tylenol number 3 and oxycodone PRNs. So the question is, what's the rationale of combining them? Okay, so we're going to discuss all these things. Okay, this patient got a lot of adjuvants, gabapentin and baclofen and dexamethasone. So the question is, when do you choose an adjuvant? Which one do you choose? Do you combine adjuvants? Are there any benefits to combining different adjuvants? And we'll cover that. So you can see it's all over the place, but we see stronger opioids being used, morphine, oxycodone. We see weaker opioids. We see anti-inflammatories. We see steroids, lactulose, Senecot, excellent here. Okay, good. So, yes, hydromorphone. Someone decided to start with hydromorphone. 10 milligrams BID is the dose. Okay, so we're going to discuss that. When we get the table of the strengths, could someone please say, hey, let's talk about the appropriateness of hydromorphone 10 milligrams twice a day for a patient who's basically opioid naive. Okay, so will someone do that? Yeah. Okay. That's when we get the table. On the following page, you've got an example of one instrument. Now, there are many different types of instruments, and what we need to find out is which instrument is being used in this region, because I know there is a tool that's being used here. The one that you see in front of you is called the Edmonton Symptom Assessment System or Scale, and it assesses various symptoms. They include pain, tiredness, nausea, depression, anxiety, drowsiness, appetite, shortness of breath, and a sense of well-being. and it's a numerical scales from 0 to 10. Okay, so Fred has completed his ESAS, and it's got there 7 out of 10 for pain. Tiredness, so that seems to be going up, right? 4 out of 10. He describes no nausea, no depression, but look at his anxiety. He rated his anxiety about 6 out of 10.
Okay, which gives us a total of
60 milligrams.
No, 55. Yeah. Round it 55 milligrams. 24 hours. Okay.